Assalamu alaikum. Good day to all of you, dear doctors. Today I am going to share a brief discussion about humerus, which is very important for MRCS part examination. It is known to all of us that the humerus extends from the scapula to the elbow joint, and it has a body and two ends, and it is almost completely covered with muscle but can usually be palpated throughout its length. The smooth rounded surface of the head, here is the smooth rounded surface of the head, articulates with the shallow glenoid cavity, and the head is connected to the body of the humerus by the anatomical neck. Here is the anatomical neck, and the head is connected to the body of the humerus by the anatomical neck, and the surgical neck is the region. Here's the surgical neck, and the surgical neck is the region below the head and tubercles, and where they can join the shaft, and it is the commonest site of fracture. And the capsule of the shoulder joint is attached. The capsule of the shoulder joint is attached to the anatomical neck. Capsule is attached to this anatomical neck superiorly, but extends down to 1.5 centimeter on the surgical neck, and which extends down to 1.5 centimeter on the surgical neck. And here is the greater tubercle of the humerus, which is the prominence on the lateral side of the upper end of the bone, and it marches with the body below and can be felt through the deltoid inferior to the acromion, and the tendons of the supraspinatus and infraspinatus are inserted into this impression on its superior aspects. I am going to show you the tendon of supraspinatus and infraspinatus. Here's the insertion of infraspinatus, and here's the insertion of teres minor muscle, and insertion of latissimus dorsi muscles, and here's the insertion of pectoralis major muscle, and this one is the tendon of supraspinatus and infraspinatus. However, the tendon of supraspinatus and infraspinatus are inserted into the impression on its superior aspect, and the larger tubercle is a distinct prominence on the front of the upper end of the bone, and it can be palpated through the deltoid just lateral to the tip of the coracoid process. And the intertubercular groove, here is the intertubercular groove, passes on the body between the greater and lesser tubercles, and containing down from the anterior borders of the tubercles to form the edge of the groove. And the tendon of biceps within its synovial sheath passes through this groove and held within it by a transverse ligament. And the posterior surface of the body is marked by a spiral groove. Posterior surface is marked by a spiral groove. Here is the spiral groove or radial groove. It is the spiral groove, and which is spiral groove for the radial nerve, which runs obliquely across the upper half of the body to reach the lateral border below the deltoid tuberosity. And within this groove lie the radial nerve and brachial vessels, and both may be affected by fractures involving the shaft of the humerus. The lower end of the humerus is wide. This is the lower end of the humerus, which is wide and flattened anteroposteriorly and inclined anteriorly. The middle third of the distal edge forms the trochlea, and superior to this area indentations are formed. Indentations for the coronoid fossa anteriorly and olecranon fossa posteriorly. Lateral to the trochlea is a rounded capitulum which articulates with the radius, and the medial epicondyle is very prominent with a smooth posterior surface which contains a sulcus for the ulnar nerve, and collateral vessels, and its distal margin gives attachment of the ulnar collateral ligament, and in front of this the anterior surface has an impression for the common flexor tendon. And here's some important relations and clinical significance. Already I have discussed that the surgical neck, which is, here's the surgical neck, already have shown that the surgical neck which is related to the axillary nerve, and fracture of surgical neck causes axillary nerve injury and mid shaft or spiral groove. Here's the spiral groove or radial groove, which is related to the radial nerve and profunda brachii artery, and fracture causes radial nerve injury and radial nerve injury and arterial injury or brachial artery injury. And lower end of the humerus, which is related to the ulnar nerve and which lies on the medial epicondyle, and lower end or medial epicondyle, it's related to the it is related to the ulnar nerve, and fractures or injury causes ulnar nerve palsy here. Okay, that's all about humerus, and I'll discuss next topics in next video. Okay, thank you so much for